Have you ever wondered why some cancer patients seem to bounce back faster than others, even when facing similar diagnoses? I certainly did, and it led me down a fascinating path of discovery. Did you know that up to 30% of cancer patients experience symptoms of depression? That's right, nearly 1 in 3. When I first came across this statistic, it hit me like a ton of bricks. It made me realize just how interconnected our mental and physical health truly are. In this video, I'm going to take you on a journey. We'll explore the intricate dance between our minds and bodies during cancer recovery. You'll learn about groundbreaking research, hear inspiring stories, and discover practical strategies that could transform your approach to cancer treatment and recovery. When we think about cancer treatment, our minds often jump to chemotherapy, radiation, and surgery. But there's another crucial element that often goes overlooked: our mental health. As someone who's been through this journey, I can tell you firsthand that the state of our minds can have a profound impact on our body's ability to heal. Whether you're a cancer patient, a caregiver, or simply someone interested in health and wellness, understanding this connection is vital. It's not just about feeling better emotionally, although that's certainly important. It's about potentially improving treatment outcomes, reducing side effects, and enhancing overall quality of life during one of life's most challenging experiences. I'm not just speaking from textbooks here. I've walked this path myself. As a cancer survivor and now a researcher in the field of psycho-oncology, I've seen both sides of this coin. I've felt the crushing weight of a cancer diagnosis, and I've also witnessed the incredible resilience of the human spirit when mind and body work in harmony. In the next few minutes, we're going to dive deep into the world of mental health and cancer recovery. We'll explore the latest scientific research, hear from experts in the field, and most importantly, learn practical strategies that you can start implementing today. By the end of this video, you'll have a new perspective on the role of mental health in cancer recovery, and hopefully, a renewed sense of hope and empowerment. Let's start by painting a picture of what many cancer patients experience psychologically. When I was diagnosed, it felt like my world had been turned upside down. Fear, anxiety, and uncertainty became my constant companions. And I'm not alone in this. Studies show that up to 40% of cancer patients experience significant psychological distress. This distress isn't just uncomfortable. It can have real, tangible effects on our bodies. Chronic stress can weaken our immune systems, disrupt our sleep patterns, and even interfere with our body's ability to repair DNA damage. It's a vicious cycle. The cancer causes stress, and the stress can potentially make the cancer harder to treat. But here's the good news. By addressing these psychological challenges, we can potentially improve our body's ability to fight cancer and respond to treatment. Now, let's get into the nitty-gritty of how our mental state affects our physical health. It all comes down to something called psychoneuroimmunology, the study of how our thoughts and emotions influence our nervous and immune systems. When we're stressed, our bodies release hormones like cortisol and adrenaline. In short bursts, these hormones can be helpful, but when we're constantly stressed, like many cancer patients are, these hormones can suppress our immune function, potentially making it harder for our bodies to fight cancer cells. On the flip side, positive mental states can have beneficial effects. Studies have shown that practices like meditation and mindfulness can actually boost our immune function and reduce inflammation in the body. One study I found particularly fascinating showed that breast cancer patients who participated in a mindfulness-based stress reduction program had significant increases in their natural killer cell activity. These are the cells that help our bodies fight cancer. So how can we put this knowledge into practice? Here are some strategies that have been shown to be effective. Mindfulness and meditation. Even just 10 minutes a day of mindfulness practice can make a difference. There are plenty of apps and online resources to help you get started. Cognitive Behavioral Therapy, CBT. This type of therapy can help you reframe negative thoughts and develop coping strategies. Many cancer centers now offer CBT as part of their supportive care services. Support groups. Connecting with others who understand what you're going through can be incredibly powerful. I found my support group to be a lifeline during my treatment. Exercise. Physical activity, even gentle movement like yoga or walking, can boost mood and reduce stress. Always check with your doctor about what's safe for you. Expressive writing. Journaling about your experiences and emotions can help process difficult feelings and reduce stress. Remember, it's not about forcing yourself to be positive all the time. It's about finding healthy ways to cope with the very real challenges of cancer treatment. Let me share a story that illustrates the power of this mind-body connection. I met Sarah during my own treatment. She was diagnosed with stage 3 breast cancer and was struggling with severe anxiety and depression. Her doctors were concerned because she wasn't responding to treatment as well as they'd hoped. Sarah decided to take a holistic approach to her treatment. She started seeing a therapist, joined a support group, and began practicing mindfulness meditation. Within a few months, not only did her mood improve dramatically, but her doctors were amazed at how her body started responding better to treatment. Her tumor markers began to decrease, and she experienced fewer side effects from chemotherapy. Now, I'm not saying that mental health interventions can cure cancer, but Sarah's story, along with many others I've encountered in my research, shows how powerful the mind-body connection can be in supporting conventional cancer treatments. As we've explored today, the connection between mental health and cancer recovery is profound and multifaceted. From the psychological landscape of cancer patients to the science of psychoneuroimmunology, we've seen how our mental state can influence our physical health in tangible ways. Mental health matters. Your psychological well-being is not a luxury. It's a crucial part of your cancer treatment. There's science behind it. The mind-body connection isn't just feel-good philosophy. It's backed by rigorous scientific research. You have tools. From mindfulness to therapy to support groups, there are many evidence-based strategies you can use to support your mental health during cancer treatment. It's a team effort. Don't hesitate to talk to your healthcare team about your mental health. Many cancer centers now offer integrated mental health support. I'd love to hear from you. Have you experienced the mind-body connection in your own cancer journey? What strategies have you found helpful? Share your experiences in the comments below, and let's continue this important conversation. If you found this information helpful, please give this video a thumbs up and consider subscribing to my channel. In future videos, we'll be diving deeper into specific mental health strategies for cancer patients, exploring the latest research in psycho-oncology, and hearing more inspiring stories from cancer survivors. Remember, your mind is a powerful ally in your cancer journey. By nurturing your mental health, you're giving your body extra support in its fight against cancer. You're not just a passive recipient of treatment, you're an active participant in your healing process. Thank you for joining me on this exploration of the mind-body connection in cancer recovery. Until next time, take care of your mind, and your body will thank you.